Scientists and medical researchers have for years differed over the precise definition of a plague. Is it a plague, or an epidemic? But one thing everyone agrees on is that the word describes the widespread occurrence of disease, in more than what might normally be expected during a countryside. Cholera, plague, smallpox, and influenza are a number of the foremost brutal killers in human history. And outbreaks of these diseases across international borders are properly defined as pandemic, especially smallpox, which throughout history has killed between 300-500 million people in its 12,000-year existence. 1 Antonini Plague, 165 AD, death toll, 5 million. Cause, unknown. Also referred to as the Plague of Galen, the Antonini Plague was an ancient pandemic that affected Asia Minor, Egypt, Greece, and Italy and is assumed to possess been either smallpox or measles, though truth cause remains unknown. This unknown disease was brought back to Rome by soldiers returning from Mesopotamia around 165 AD. Unknowingly, that they had spread a disease which could end up killing over 5 million people and decimating the Roman army. 2 Plague of Justinian, 541-542. Death toll, 25 million. Cause, bubonic plague. Thought to possess killed perhaps half the population of Europe, the Plague of Justinian was a plague of the plague that afflicted the Byzantine Empire and Mediterranean port cities, killing up to 25 million people in its year-long reign of terror. Generally considered the primary recorded incident of the Plague of Justinian left its mark on the planet, killing up to 1/4 of the population of the eastern Mediterranean and devastating the town of Constantinople, where at its height it had been killing an estimated 5,000 people per day and eventually leading to the deaths of 40% of the city's population. 3 The Black Death, 1346-1353. Death toll, 75-200 million. Cause, bubonic plague from 1346 to 1353. An epidemic of the plague ravaged Europe, Africa, and Asia, with an estimated price between 75 and 200 million people. Thought to possess originated in Asia, the plague presumably jumped continents via the fleas living on the rats that so frequently lived aboard merchant ships. Ports, being major urban centers at the time, were the proper track for the rats and fleas, and thus the insidious bacterium flourished, devastating 3 continents in its wake. 4 Third Cholera Pandemic, 1852-1860. Death toll, 1 million. Cause, cholera. Generally considered the foremost deadly of the 7 cholera pandemics, the third major outbreak of cholera within the 19th century lasted from 1852 to 1860. Like the first and second pandemics, the third cholera pandemic originated in India, spreading from the Ganges Delta before tearing through Asia, Europe, North America and Africa, and ending the lives of over 1 million people. British physician John Snow, while working during a poor area of London, tracked cases of cholera and eventually succeeded in identifying contaminated water because the means of transmission for the disease. Unfortunately, an equivalent year as his discovery, 1854, went down because the worst year of the pandemic, during which 23,000 people died in Great Britain. 5 Flu Pandemic, 1889-1890. Death toll, 1 million. Cause, influenza. Originally the Asiatic flu, or Russian flu, because it had been called, this strain was thought to be a plague of the influenza plague subtype H2N2. Though recent discoveries have instead found the cause to be the influenza and epidemic subtype H3N8. The first cases were observed in May 1889 in 3 separate and distant locations: Bukhara in Central Asia, Turkestan, Athabasca in northwestern Canada, and Greenland. Rapid increase of the 19th century, specifically in urban areas, only helped the flu spread, and soon the outbreak had spread across the world. though it had been the primary true epidemic within the era of bacteriology and far was learned from it. In the end, the 1889 to 1890 flu pandemic claimed the lives of over 1 million individuals. Sixth cholera pandemic 1910 to 1911. Death toll, 800,000 plus cause, cholera. Like its 5 previous incarnations, the sixth cholera pandemic originated in India, where it killed over 800,000, before spreading to the Middle East, North Africa, Eastern Europe and Russia. The sixth cholera pandemic was also the source of the last American outbreak of cholera, 1910-1911. American health authorities, having learned from the past, quickly sought to isolate the infected. And within the end only 11 deaths occurred within the U.S. By 1923 cholera cases had been hampered dramatically, although it had been still continuing in India. 7 flu pandemic 1918 death toll 20-50 million. Cause influenza between 1918 and 1920 a disturbingly deadly outbreak of influenza tore across the world, infecting over a third of the world's population and ending the lives of 20-50 million people. Of the 500 million people infected within the 1918 pandemic, the death rate was estimated at 10% to 20, with up to 25 million deaths within the first 25 weeks alone. What separated the 1918 flu pandemic from other influenza outbreaks was the victims. Where influenza had always previously only killed juveniles, and thus the elderly or already weakened patients, it had begun striking down hardy and completely healthy young adults, while leaving children and people with weaker immune systems still alive. 8 flu pandemic 1968 death toll 1 million. Cause influenza category 2 flu pandemic sometimes mentioned as the Hong Kong flu. The 1968 flu pandemic was caused by the H3N2 strain of the influenza epidemic, a genetic offshoot of the H2N2 subtype. From the primary reported case on July 13, 1968 in Hong Kong, it took only 17 days before outbreaks of the virus were reported in Singapore and Vietnam, and within 3 months had spread to the Philippines, India, Australia, Europe, and therefore the US. While the 1968 pandemic had a relatively low death rate, 5%, it still resulted within the deaths of quite 1 million people, including 500,000 residents of Hong Kong, approximately 15% of its population at the time. 9 Asian flu 1956 to 1958 death toll 2 million. Cause influenza. Asian flu was an epidemic outbreak of influenza of the H2N2 subtype that originated in China in 1956 and lasted until 1958. In its 2-year spree, Asian flu traveled from the Chinese province of Guizhou to Singapore, Hong Kong, and therefore the US. Estimates for the price of the Asian flu vary counting on the source, but the Planet Health Organization places the ultimate tally at approximately 2 million deaths, 69,800 of those in the US alone. 10 HIV AIDS pandemic at its peak, 2005 to 2012. Death toll, 36 million. Cause, HIV AIDS. First identified in Democratic Republic of the Congo in 1976, HIV AIDS has truly proven itself as a worldwide pandemic, killing quite 36 million people since 1981. Currently there are between 31 and 35 million people living with HIV. The overwhelming majority of these are in sub-Saharan Africa, where 5% of the population is infected, roughly 21 million people. As awareness has grown, new treatments are developed that make HIV much more manageable, and lots of these infected continue to steer productive lives. Between 2005 and 2012, the annual global deaths from HIV/AIDS dropped from 2.2 million to 1.6 million. What about COVID-19, the novel coronavirus? Beginning in December 2019, within the region of Wuhan, China, a replacement novel coronavirus began appearing in citizenry. It has been named COVID-19, a shortened sort of coronavirus disease of 2019. This new virus spreads incredibly quickly between people. Thanks to its newness, nobody on Earth has an immunity to COVID-19, because nobody had COVID-19 until 2019. While it had been initially seen to be a plague in China, the virus spread worldwide within months. The WHO declared COVID-19 an epidemic in March, and by the top of that month, the planet saw quite 500,000 people infected and nearly 30,000 deaths. The infection rate within the US and other nations was still spiking. With the coronavirus pandemic, people everywhere the planet became more conscious of the simplest practices during an epidemic, from careful hand washing to social distancing. Countries across the planet declared mandatory study-at-home measures, closing schools, businesses, and public places. Dozens of companies and lots of more independent researchers began performing on tests.